Alright, and the third part of our pharmacology is related to the peripheral nervous system. We're going to look at skeletal muscle relaxants and local anesthetics. Objectives for this portion of the lecture is you should be able to describe two ways skeletal muscle relaxants work. You should be able to name a common skeletal muscle relaxant. You should be able to explain how local anesthetics work, and you should be able to name a common local anesthetic. So let's start off with skeletal muscle relaxants. They work by blocking that neuromuscular receptors, so therefore they can limit how much a muscle contracts. So if you remember those actin and myelin fibers, they interfere with those being able to slide and cause a muscle to contract. So whichever specific chemical mechanism they have, ultimately they all work by limiting contractivity of the muscles, and many of them work in conjunction of blocking those neuromuscular receptors, which then will not allow the skeletal muscle fibers to slide and contract. So on your drug summaries, I did give you a skeletal muscle relaxant to look up, and hoping that you remember that was Skelaxin. Again, remember, look at the name, and it brings you into some clues as to that is the trade name and how that name came about. It's a skeletal muscle relaxant. Skelaxin. Makes sense. Great marketable drug. So what would be a reason that we would go and want to relax someone's muscles, specifically the skeletal muscles? In this case, clinical indications for this type of medications would include spastic diseases, things such as multiple sclerosis and cerebral palsy, where you have muscular contractions that are debilitating to a person, in which case, if we can decrease those contractions, we increase their mobility. Injuries. This is probably the most common prescription for skeletal muscle relaxant. Someone lifts something inappropriately and tweaks their back. Okay, is in an automobile accident, whiplash, those type of things where we're getting contraction of the muscles in response to some trauma. And then another reason we may also see them used, as we talked about earlier in a previous section, with surgical procedures. If we can relax the skeletal muscles, for example, muscles in the throat and in the diaphragm, it makes intubation easier of a person. So if we have someone who we're using a regional anesthesia or a local anesthesia on, but we need them to relax and lie still for us, again, a skeletal muscle relaxant in conjunction with the other anesthetic may be of great use during an operative procedure. Now, when we're talking about medications that will go and relax the muscles, we need to be aware that there are some things that people, if they take along with the medications, will potentiate them. That means make their effects even greater. So what are things that you would think, if you're thinking about a skeletal muscle relaxant, something that relaxes the muscles of the body, okay, what are some things that also relax the muscles of the body that if given along with or taken along with a skeletal muscle relaxant would make its effect more profound? Couple of the ones that I can think of, one would be anesthetics. Okay, anesthetics relax the muscles. So if we have a muscle relaxant on top of an anesthetic, we're going to get a more profound effect. Narcotics. If someone is taking a narcotic either therapeutically or recreationally, and they're also taking a skeletal muscle relaxant, you will see an increase in the effects of the relaxant. And the one that we need to be most concerned about is that of alcohol. Alcohol is a depressant, and taken along with a skeletal muscle relaxant will potentiate the muscle relaxant. So that's key that we tell people who are on these medications. You cannot drink alcohol while you are taking these medications. So when we're talking about those effects, we not only get the effects of the muscles relaxing, we may also get some other adverse effects from these medications. And those would include things like dizziness, weakness, and the biggest one that we need to be most concerned about is paralysis of the respiratory muscles. If we are relaxing the muscles, these medications can relax the respiratory muscles too. Take too much of it, then more than your body can handle, and someone can stop breathing. Not a good thing. So that's our big fears, particularly if we have, like I said, some of these other things that can potentiate the skeletal muscle relaxant. Then our last topic that we're going to take a look at here with drugs that affect the peripheral nervous system is that of our local anesthetics. And you may hopefully recall from an earlier time period in our pharmacology course, we had a classification of medications that we talked about that were also local anesthetics. So do you remember what that was? Okay, hopefully all of you have answered Class 1 antiarrhythmics. Our Class 1 antiarrhythmics were also local anesthetics. And that is, they worked as a Class 1 antiarrhythmic when given into or absorbed directly into the bloodstream. So on this, if you recall, how do they work? Okay, and do you remember what channel blocker they were called? We called them a sodium channel blocker. They interfere with sodium crossing cell membranes. So they actually block the nerve fibers' conduction and keep them from conducting their impulses along by inhibiting sodium from going across the cell membranes. So, how do we give them? We talked about how we gave Class 1 antiarrhythmics, but how do we give local anesthetics? And the truth is, it's the same medication. It's the route that makes it different. The route that changes it from being a local anesthetic to a Class 1 antiarrhythmic. Local anesthetics are given either topically or by injection. Topically, you can see them given in creams, in sprays, or even in patches. The patch form works really well sometimes with our elderly population who are having some like osteoarthritis issues and pains in their joints. So we can put a daily patch on of a local anesthetic that helps with some of that pain in those joints. You'll see it used on topically if you've ever put solar cane on. Solar cane has an anesthetic in it, it's local anesthetic that helps numb the skin when you have a sunburn going on. And the stuff you spray in the back of your throat for a sore throat, chloroseptic, is another topical way we can deliver an anesthetic to an area to decrease pain. The other way would be giving it by injection. If you've ever had dental work done, and local anesthetic may have been injected with a needle into your gums prior to doing the work. So we inject it directly into the area of the nerve fibers, block the sodium from crossing, and then we can do a procedure that we need to do. Also for insertion of, I think of another insertion of IVs, I frequently would give a small injection of local anesthetic before putting an IV in so someone tolerated the procedure a little better. So if we go and we take and inject it into the bloodstream though, what would be our effect? Okay, in this case, we could decrease cardiac function. So the concern with the injectable is that you want to make, the physician needs to make sure that they are only injecting into the subcutaneous or tissues of the skin, whereby they are not injecting directly into a vein or an artery. If they would do that, then they will see the cardiac effects of the medication. Depressed cardiac function, you can have a patient crash on you. It's one of the things specifically you need to be very careful in the dentist office with. So what drug from your drug summaries was a local anesthetic? I believe it gave you lidoderm. You may also heard the term lidocaine, lidoderm. They are but local anesthetics that are used topically, or as the lidoderm as a topical patch, or in the form of lidocaine as an injectable for doing procedures where we just need a small amount of anesthesia to decrease pain. Okay, with that then, we have finished up our materials on the peripheral nervous system, or medications related to the peripheral nervous system. And once you're done and you've reviewed your materials and you're comfortable and you take your quiz, you can start working on your drug summaries for the next unit. And the next unit will be the central nervous system, and the drug summaries that you'll want to complete by submitting into the drug summary form are Lyrica, Abilify, OxyContin, Cymbalta, Celebrex, and Lexapro.